For more on the government speech from the throne, Jean-Yves Duclos is the Minister of Health. He is in the West Bloc. Minister Duclos, thank you for speaking with us. As we just heard right there, Bloc Québécois leader Yves-François Blanchet says his party will live with your speech, meaning that he's not going to make this something that your government's going to fall over. So what message are you trying to send to Canadians with today's throne speech?
Well, good evening, Katie, and good evening to everyone listening. And I was listening earlier to Mary Simons. It was a historical day when she spoke in Inuktitut. She also said that we need to work together strongly for a better future for all Canadians. That's exactly what the throne speech is asking us to do, and that's what we will be doing on things like what David Cochrane just mentioned, making life more affordable, making sure we exit out of COVID. COVID-19 is not finished. Rebuilding our healthcare system, working with Indigenous peoples, making life better, meaning more inclusive, a cleaner economy. So these are big challenges, and we look forward to working on them with all opposition parties.
Why not introduce something big, new and shiny in today's speech from the throne?
Well, we made very big and very important promises, and I think good promises in the campaign, and we're faithful to those promises, and now we need to work together to put them into place.
Conservative leader Aaron O'Toole said in French that his party will oppose the speech. In his words, he says it will do nothing to deal with the cost of living crisis. What do you say to him and Canadians who are deeply concerned about the rising cost of living?
Well, investing $30 billion in making childcare accessible, affordable, and quality across Canada, that's something that is not small. I think it's going to transform the lives of millions of families and children, and in particular millions of women who have suffered during the crisis and who need to go back to work. We know that in Quebec, for instance, that has worked for the last 20 years. It led to greater income, greater opportunities for everyone, and greater, obviously, gender equality, and greater success for our children. So this was one example. Housing investments, very significant for home ownership, in particular by younger families, incentives to own, to rent and then own a home, all sorts of things that will make life more affordable for the middle-class Canadians.
Okay, so you're pointing to that $10 a day childcare plan, but there are still 4 places where that's not in place: Ontario, New Brunswick, Nunavut, and the Northwest Territories. Can you get all 4 of those on board before the end of the year?
Not only we can, but we have to. Again, from the perspective of a Quebec father, a Quebec academic who studied these issues for many, many years, I know and many others know that this is good not only for parents and women in particular, mothers, it's also good for the economy, it's also good for children. So I know and expect that the remaining provinces and territories will soon sign to this, because all Canadians, regardless of where they live, need to have access to a safe, affordable and quality childcare space for their children.
Ontario is home to the most number of kids that would benefit from a program like this. And from what I understand, the conversations between the federal government in Ontario were perhaps slow to start, and there hasn't been much progress there. So are you confident that Ontario, along with New Brunswick, Nunavut, and the Northwest Territories, I just want to be clear, that they will all be on board? You are confident before the end of the year?
I'm very confident of that, because I've been working closely with my colleagues, Minister Hussein and our Minister Gould. I know how hard they work on that, but they also have the support of many community organizations, stakeholders who understand the value of investing in our families and children.
NDP leader Jagmeet Singh says today's speech missed the mark and that your government should not take NDP support for granted. Do you see that as a threat at all?
No, we don't take this as a threat. I think we've been very good and very successful at working together over the last 2 years. And I think everyone understands with the throne speech and what the Governor General said, that we need to do this in a period of crisis. COVID-19 has not ended. We need to build back better our economy and our society, invest in healthcare services for everyone, reduce backlogs for surgeries and diagnostics. We need to look after access to primary care, especially in rural areas. And we need to build a cleaner environment. No, the health of our environment goes along with the health of our people. This is increasingly becoming clear in disasters like the one we've seen in British Columbia over the last few days.
You are expected to be working closely with your cabinet colleague, Carolyn Bennett, the new Minister of Mental Health and Addictions. Will your government be looking at decriminalizing some illicit drugs as a way to fight the opioid crisis?
Well, you're right. I have the privilege of working with Minister Bennett, who is the first Minister of Mental Health and Addictions in the history of the Government of Canada. She's extremely dedicated to work on all possible measures to address, for instance, the opioid crisis. The opioid crisis is killing on average 20 people every day. It's almost the same number of people that are dying of COVID-19. This is a severe crisis, and we have many other mental health crises to address with the collaboration and the support of many colleagues across Canada.
I want to be very specific, though. Is one of those options you're looking at, is it the decriminalization of illicit drugs?
Well, we'll have to see with Minister Bennett what her agenda is. But I'm sure what I have heard from her and what I know from her is that she is very mindful of the importance of the crisis and the importance of considering all sorts of support with her colleagues across the different provinces and territories.
Last week, Canadian Blood Services was preparing to ask Health Canada to end a ban on donating blood by men who have sex with men. Do you know if that formal request is in yet and what the status is there?
It is coming, we hear, and we look forward to having it as quickly as possible, in the best shape possible. And once we receive it, we will prioritize that.
How quickly can you make that happen?
Well, it depends obviously on the ease and the speed with which the Canadian Blood Services will be able to submit its submission. We also have EMA Quebec in the province of Quebec, which also needs to submit its proposal. We believe, we are very confident in their ability to do this quickly in the appropriate manner, and once that is done, we will move quickly.
All right, Minister Duclos, thank you for your time.
Thank you.